Today, we are diving right into a really dramatic and honestly often misunderstood condition that can happen after a severe brain injury. It's called neurostorming, and it is a literal perfect storm inside the brain. So, let's start with the chaos. For decades, this whole thing was a medical mystery. Depending on where a patient was, a doctor might call it sympathetic storming or maybe diencephalic seizures. In fact, there were over 30 different names floating around in the medical world. Just imagine trying to research or treat something when nobody can even agree on what to call it. It was a huge problem for doctors and, you can imagine, absolutely terrifying for families. And all that confusion, it had really dangerous real-world consequences. We're talking about delayed diagnoses, delayed treatments. It was just not good. But then, in 2014, we hit a major turning point. An international group of experts got together and finally just cut through all that noise. They created a consensus, getting rid of dozens of names and giving us one single unified term. And for the very first time, they created a standard checklist for how to diagnose it. This was a massive leap forward for patient care. So what's the official name they landed on? Paroxysmal Sympathetic Hyperactivity, or PSH for short. I know, it's a bit of a mouthful, right? That's why you'll still hear people call it neurostorming. But this definition is super precise, so let's just quickly break it down. Paroxysmal means it happens in these sudden reoccurring episodes, and sympathetic hyperactivity points to that fight-or-flight system going into complete overdrive. The key part is that it's all happening at once, that hyperactivity and abnormal motor activity. Right, so the main thing to get here is that PSH isn't just one symptom. Oh no. It is a whole constellation of them hitting the body all at the same time. We're talking heart rate skyrocketing, blood pressure soaring, breathing becoming frantic. The body is just burning up with fever, drenched in sweat, all while the muscles are locking up into these rigid, painful positions. It's a total full-body crisis. So that leads us to the big question, right? What on earth is going on inside the brain to cause such a violent, overwhelming reaction? Well, to really get it, it helps to think of your nervous system kind of like a car. Okay, so in this car, your sympathetic nervous system, that's the accelerator, that's the gas pedal. It's what kicks in your fight or flight response, revving up the engine when you're facing something stressful or dangerous. It gets you ready to act fast. But you can't have a gas pedal without brakes, right? So in a healthy brain, the higher level thinking parts of your brain, up in the cortex, they act like a really sophisticated braking system. They're constantly providing this calming, inhibitory control, making sure that gas pedal isn't just floored 24/7. So here's what happens after a severe brain injury. There's this leading idea called the disconnection theory, and it says the injury basically wrecks the pathways between those higher brake centers and the lower accelerator centers. It's literally like someone went in and just cut the brake lines. And what happens when the brakes are gone? The accelerator is just slammed to the floor, completely unchecked. That fight-or-flight system goes into absolute overdrive, triggering this massive, totally exaggerated surge, not because of a real threat, but from something as simple as a nurse turning a pillow, or even just the beep of a machine in the room. And get this is not some super rare thing. PSH can happen in up to 1/3, that's 33%, of patients who are in a coma after a severe traumatic brain injury. That is a huge number of people who make it through the initial injury only to face this awful secondary battle. So you can see the huge challenge for doctors here. You've got a patient with a high fever, a racing heart, crazy high blood pressure. Well, that could easily be a life-threatening infection like sepsis. The muscle posturing, that could look just like a seizure. So with all these symptoms overlapping, how can they possibly know for sure that they're dealing with PSH? Well, thankfully, the answer is in a really powerful diagnostic tool that was created by that same 2014 consensus group. It's called the PSH Assessment Measure, or PSAM, and it's all about bringing objective data and real clarity to the diagnosis. Now, what's so cool about this tool is that it has a two-part approach. Part one is all about the raw data. It scores the severity of the physical symptoms, like exactly how high the heart rate is, what the temperature is, and so on. But part two, that part acts more like a detective. It looks at the bigger picture and asks key questions. Are these episodes coming out of nowhere? Are they being triggered by things that really shouldn't be painful? By combining those scores, doctors get a final number. And if that number is 17 or higher, a PSH diagnosis becomes very probable. It's just a brilliant, systematic way to finally separate this one specific storm from all the other lookalikes.
Okay, so once PSH is the likely diagnosis, the mission becomes crystal clear, even if getting there is pretty complex. It's time to calm the storm.
And the approach isn't about finding one single magic bullet, it's what's called multimodal. So first, you manage the patient's environment, trying to reduce any triggers like loud noises or bright lights. Second, you provide intense supportive care to deal with those high fevers and the huge amount of energy the body is burning. And third, you bring in the targeted medications. Now, the medication strategy is actually two-pronged. On one hand, you have what's called abortive therapy. These are fast-acting drugs used to stop a storm that's already raging, to put out the fire. But the real goal is preventive therapy. This means using a strategic mix of medications to try and regain some control over that haywire nervous system, hoping to make future storms less frequent and way less intense. So let's just pull back for a second. We've talked about what neurostorming is and how it's managed, but why? Why is getting this diagnosis right so unbelievably important for a patient's future? Because if you don't get that clear diagnosis, the fallout is severe. These storms burn an incredible amount of energy, which leads to weight loss and muscle wasting. The bottom line is longer, way more complicated stays in the ICU, which means higher healthcare costs and, most importantly, a much, much tougher road to recovery. And this right here really gets to the heart of why all of this matters so much. A patient simply can't start the hard work of rehab, physical therapy, occupational therapy, speech therapy, if their body is constantly being thrown into a state of crisis. Calming the storm isn't the finish line, it's the absolute essential first step that unlocks the door to rehabilitation itself. It can literally define their entire long-term outcome.